everybody. Welcome back to our YouTube channel. My name is Dr. Mike Blaney, bariatric surgeon in Augusta, Georgia. Today we're going to talk about lack of energy after weight loss surgery. We all understand we had weight loss surgery to lose weight, to feel great, and have a lot more energy. And that will happen, almost guaranteed. You're going to feel great and you're going to have a lot more energy down the road, certainly once you've lost a bunch of weight. But it is very common in the beginning after weight loss surgery to just feel washed out and run down. And here's what I think is happening. In our practice, as in many practices, you probably were on a preoperative liquid diet for a week or two right before surgery. The reason we do this is to help get you ready for surgery, help shrink the liver and make surgery a little bit easier. After surgery, obviously, we've now done a major operation to the stomach, so we logically want to progress through diet consistency from liquids to soft to solid foods, and how quickly you may progress through that varies from one surgical practice to the next. But in general, what we do in our practice is focus on a liquid diet for 10 days to 2 weeks after surgery, and then go to soft foods for a month or so, and then more solid foods or a regular diet after about 4 to 6 weeks. Now everybody will progress through this at various rates. So I think when we're kind of feeling run down and a lot of lack of energy the first month or two after weight loss surgery, it's in large part because you've radically changed your diet. You've been mostly eating liquids or drinking liquids, and when you are getting back to more regular foods, you're eating such a small amount. Of course, you're losing weight as well, and that takes out a lot of energy out of our body. I start to notice that I hear these complaints about lack of energy around 4 to 6 weeks after surgery. And then folks' energy starts to come back after, about 2 to 3 months. Taking vitamins is also very important. I notice that patients that tend to be more lackadaisical about their vitamins tend to complain more often of lack of energy. Now, lack of energy long-term after weight loss surgery can be an issue. Maybe many years later, you're starting to feel tired and run down. In most cases, this is due to a vitamin deficiency, most commonly iron. It's very common after gastric bypass surgery to have an iron deficiency, and that's simply because iron is absorbed in the upper part of the gastrointestinal tract, and because we bypassed a portion of the upper GI tract, our ability to absorb iron in some patients are limited. Now, not everybody's going to develop an iron deficiency. Certainly the minority of individuals have what I would consider to be problems with keeping their iron level elevated, but if you do fall into that category, it's easily treated. Most of the time you can supplement with oral iron, but most people don't like to take oral iron, and they may not even absorb it even if they are taking high doses of oral iron. So the easiest way to increase our level of iron is to do an IV iron infusion. Periodically, our patients after a gastric bypass will require an iron infusion every few years. But don't worry, most of the time these infusions become much, much less frequent over time, and then you don't have to do it anymore because I think our body gets better at absorbing these nutrients. So I hope that was helpful. For more interesting topics about weight loss surgery, please tune in to our YouTube channel.